Hi everybody, I have Bob Burridge here. He's a client of mine for about 4 or 5 years. Bob runs 2 miles 4 times a week.
4 or 5.
What?
4 or 5.
Oh, 4 or 5 times a week. So I wanted to introduce you to Bob. And Bob, you came to see me about what, 5 years ago?
Yeah, about 5 years.
Okay. And what was going on when you came to see me?
Okay, well, what was going on was that I had snapped my quadriceps by falling down some stairs about 4 years before that, and I was off and I couldn't run, but even after my quadriceps mended, I had shooting pains in my leg which prevented me from getting back to jogging, and I didn't realize what was going on, and I happened to run into Andrew, who, and I thought, well, he told me what he did and the sort of work he did, and I felt that he could help me, and he certainly did. To me, it seemed that I had damaged other things other than my quadriceps, and put my back out and so on, which led to pains in my legs and other parts of my body, which prevented me from jogging. But Andrew was able to manipulate me and massage me, and he's very skillful at this sort of thing because he's done it on himself for years. He's a tennis player. He's really quite athletic, and I don't regard myself as an athlete. I'm really run to keep my mind healthy rather than my body. But I enjoy it and feel good when I jog. So I wanted to get back to jogging, but it was too early at that point. But after a number of years with Andrew, I felt encouraged that I thought I could do it because I was walking quite a lot, and I could jog a little bit, a few yards at a time. But I thought, well, really, I should really try and do this. I'd love to do it when I was 80 years old. I felt when I was 60 I'd like to do it when I was 70, but I was about 72 when I fell down the stairs. Anyway, sometime before I was 80 years old, I gradually increased my distance from a few yards to a mile or two, and now I jog regularly a couple of miles. I could probably go further, but time is of the essence these days, and so anyway, I feel very good. Andrew is very conscientious. He goes over my body with his rapid release machine, and also, what do you call your electrical one?
Electroacupuncture.
Electrical acupuncture, and he releases tense and tightened connective tissue, which seemed to be the key to keeping me going, and he maintains me in a good shape, so that I feel very good these days. And luckily I haven't had any trouble with my back as I used to, and my shooting pains in my legs, and so I'm very grateful for Andrew's great skill and conscientiousness, because he really spends a lot of time and goes over me very carefully, and I really appreciate that.
Thank you, and I just want to make a few points. So one of the things that helped Bob get back into jogging is he did purchase our vibration machine, our $350 vibration machine, which I call doing your homework. And that vibration machine really does help a lot with connective tissue. Mm-hmm. And so please take a look at our vibration therapy program. So once he started doing that, he was really able to tonify that connective tissue on a daily basis to where he could, I didn't even think he could go back to running, honestly. I was very skeptical. And after the first time he ran, he came in for treatment. Everything was pretty tight, and then I worked on him. And then the next time he came in, he responded very quickly, and his body actually adapted to the running, and he's been running ever since. So yes, it's a combination of rapid release on connective tissue, acupuncture, electroacupuncture, and craniosacral. That's kind of the magic of the work. And then when the client goes home and cooperates and does some vibration therapy, and it can really accelerate and can reinforce the work. So yes, thank you. Any other observations, comments? How's your overall energy? Your
my energy is pretty good. I must say that as one does, one feels tired at bedtime, but I think that's a good thing, and I can't complain about my energy these days.
Yeah, Bob also does the Blue Z water, and integral to our treatments is balancing the meridians, taking the Chinese pulses and getting those acupuncture meridians in balance, because that has a lot to do with health, and that they're very telling on one's overall well-being. So yes, thank you for all your cooperation, and congratulations. Bob's about to turn 81 and is out there jogging 4 or 5 times a week, so I wanted to share that with everybody out there. So anyone who's injured, anything's possible, because if at 81 if at 81 you could be back on the track doing running, imagine if you're in your 50s, 40s, 30s, and you're never really fully recovered from injury. So it's real critical once you're injured to understand how to reset the entire body. It takes a lot of detail work and getting the energy body back in flow. A lot of times when there's injury, there's a lockdown in the rhythm of the body and the fascia, so it's really important to get all that reset. All right, Bob, thank you.
Thank you.
All righty.
Help.
All righty, take care.
Yeah. Cheers.
Oh, and any questions, please email me, andrew@bluesywater.com or andrew0528@aol.com. We'll post links to both our websites. Thank you.